Your kidneys filter 200 liters of blood every single day. And after 40, they start failing, with zero pain, zero symptoms, zero warning, until you've already lost more than half of them. 37 million Americans have kidney disease right now. 90% have no idea. Stay till the end. I'm going to show you 5 signs your body is sending you right now. One of them happens every single morning. Comment below. Do you wake up tired even after 8 hours of sleep? Subscribe. Next week, I'm showing the blood test that catches this 10 years early. Your doctor probably isn't ordering it. Here's the thing that nobody tells you. The kidney test your doctor runs every year, serum creatinine, does not catch kidney damage until you've already lost 50% of kidney function. 50%. Half your kidneys. Gone. And the test says normal. This isn't a conspiracy. It's just how the test works. Creatinine is a waste product that builds up in the blood when kidneys fail. But the kidneys have enormous reserve capacity. They can lose almost half their function and still clear creatinine fast enough to look normal on paper. A 2019 study in the Journal of the American Society of Nephrology put numbers on this. 37 million Americans have chronic kidney disease. 33 million of them, 90%, have no diagnosis, normal blood work, normal creatinine, failing kidneys. After 40, kidney function declines about 1% per year, even in perfectly healthy people. No disease, no risk factors, just aging. By 60, you may have 20% less function than at 40. By 70, potentially 30% less. And unlike most organs, kidney tissue that dies does not regenerate, ever. What's lost is lost permanently. So the question becomes, if the standard test misses it and there's no pain, how do you know? Your body is sending signals, specific, reproducible signals that have nothing to do with your back or your joints or your sleep schedule. Signals that millions of people experience every single day and never connect to their kidneys. The first one happens the moment your alarm goes off. You slept 8 hours. You wake up exhausted. You need coffee before you can speak. By mid-morning, you're functional. By 3 p.m., you're crashing again. You've told yourself it's stress. It's age. It's just how things are now. Here's what's actually happening inside your body. Your kidneys produce a hormone called erythropoietin, EPO. PO tells your bone marrow to make red blood cells. Red blood cells carry oxygen to every cell in your body, your brain, your muscles, every organ. When kidney function drops, EPO production drops. When EPO drops, red blood cell production drops. Gradually, over months and years, so slowly you don't notice it happening, your blood starts carrying less oxygen than it used to. You wake up exhausted because your cells are running on less oxygen than they need. Not metaphorically, physiologically. This is called renal anemia, and it is one of the earliest markers of kidney decline. A 2021 study in the Clinical Journal of the American Society of Nephrology found that renal anemia begins when kidney function drops below 60%, a level that appears completely normal on the standard creatinine test. So you can have clinically significant oxygen deprivation from kidney decline, and your doctor looks at your blood work and says, everything looks great. Now, morning fatigue alone has many causes: thyroid, sleep apnea, iron deficiency, depression. One symptom isn't enough. But here's what makes kidney-related fatigue specific. It almost always comes with the second sign. And the second sign happens every night, usually multiple times. And most people have been told it's completely normal. You wake up once, twice, sometimes 3 times a night to urinate. You've done it for years. Your doctor said it's probably the prostate, or the bladder getting weaker, or just drinking too much water before bed. Here's the physiology that explains why this is actually your kidneys. Healthy kidneys have a night mode. When you lie down and stop drinking, they shift into conservation, producing less urine, highly concentrated, so you can sleep 7 or 8 hours without waking. This concentrating ability is one of the first functions to decline as kidney health drops. When it goes, the kidneys produce the same volume of dilute urine at 2 a.m. that they produce at 2 p.m. Your bladder fills. You wake up every night. A 2020 study in nephrology dialysis transplantation found that adults who woke up to urinate 2 or more times per night had a 60% higher rate of early chronic kidney disease than those who slept through. 60%. Not a weak association. A strong, consistent signal. I had a patient, Richard, 52, a sales manager from Dallas, waking up twice every night for 3 years. His doctor prescribed a prostate medication. He took it for 8 months. Nothing changed. When I saw him, I ran cystatin C and a urine albumin test, not the standard creatinine. His filtration rate was 58%. Early stage 3 chronic kidney disease. His prostate was completely normal. We addressed the actual problem. Hydration protocol, blood pressure brought from 138/88 down to 118/76, stopped his regular ibuprofen for back pain. 4 months later, sleeping through the night, fatigue gone. He told me he felt 10 years younger. He still has CKD, but it stopped progressing. And it took 3 years and 8 months of wrong treatment before anyone checked his kidneys. Morning fatigue plus nocturia, that's 2 signs together. If you have both, the next 2 signs I'm going to show you are visible. You can see them right now, today, without any test. Stay with me. 2 signs, both visible. Both require nothing but paying attention to things you already see every day. And both are almost universally ignored, not because people don't care, but because nobody told them what they mean. Sign 3, foam in the toilet. The next time you urinate, look before you flush. If you see bubbles or foam that stays for more than a few seconds after you finish, not the brief fizz of the stream, but persistent foam that sits there, that is protein in your urine. Healthy kidneys keep protein in the bloodstream. The filter is tight enough to hold large molecules like protein while letting waste through. When kidney damage occurs, the filter develops holes. Protein leaks into the urine. When protein hits water, it creates foam, the same chemistry as whisking egg whites. The foam in your toilet is protein that belongs in your blood. Proteinuria, protein in urine, is not just a sign of damage. It accelerates damage. Protein in the kidney tubules is directly toxic to the cells lining them. A 2018 study in The Lancet found that persistent proteinuria increased kidney disease progression risk by 400%. Not 40, 400%. It is one of the strongest predictors of kidney decline in medicine, and most people see foam in their toilet every morning for years and think nothing of it. Sign 4, swelling. Puffiness around the eyes when you wake up. Ankles that swell by end of day. The kidneys regulate your body's fluid and sodium balance. When filtration drops, sodium and fluid that should be excreted accumulate in tissue. Gravity pulls it to the ankles during the day. When you've been lying flat all night, it distributes upward. Puffy eyes, swollen face. Most people blame salt, or flying, or standing too long. Sometimes it is those things, but if it's happening consistently, puffy eyes most mornings, ankles reliably swollen by evening, your kidneys may not be clearing fluid the way they should. 4 signs now: morning fatigue, night urination, foam in the toilet, consistent swelling. If you have 2 or more of these consistently, that is your body speaking. And there is a 5th sign that connects all of them, one that most people would never think to associate with their kidneys, one that your doctor probably called a little elevated and told you to watch your salt. Blood pressure of 132/84. Your doctor looks at it and says, borderline, watch your diet. Come back in 6 months. You leave the appointment and forget about it. Your kidneys don't forget about it. The kidneys filter blood through roughly 1 million microscopic structures called glomeruli in each kidney. Each one is a tiny high-pressure filter. Blood pressure drives filtration. But chronically elevated pressure, even borderline, even 130/85 sustained over years, creates mechanical stress on these filters. The walls thicken. The filters scar. Function drops. And here's the spiral that makes this uniquely dangerous. Damaged kidneys raise blood pressure. Elevated blood pressure damages kidneys. Each makes the other worse. Once this cycle starts, and in most people it starts silently in their 40s, it accelerates unless someone intervenes. A 2017 study in the New England Journal of Medicine found that reducing systolic blood pressure from 140 to 120 reduced the rate of kidney function decline by 34%, more than any medication specifically designed to protect kidneys. The threshold that matters is lower than most people think. Below 120/80 is protective. Above 130/80, the damage is already beginning. I had another patient, Linda, 47, a teacher from Phoenix, came to me for fatigue and ankle swelling that her previous doctor attributed to being on her feet all day. Her blood pressure had been running between 134 and 140 systolic for 4 years. Routine creatinine, always normal. When I ran a cystatin C and urine albumin, her filtration rate was 62%, and she had significant proteinuria. She had foam in her toilet every morning. She thought it was normal. We treated the blood pressure aggressively, got her to 116/72 within 3 months through dietary changes and a low-dose ACE inhibitor, which has the additional benefit of reducing proteinuria directly. The swelling resolved in 6 weeks. The fatigue improved significantly. At her 12-month follow-up, her filtration rate had improved to 71%. The only direction kidney function almost never moves is up. Hers went up because we caught it early enough and addressed the actual cause. Linda had 4 of the 5 signs for years. Nobody connected them. Now stay with me for the last part, because knowing the signs without knowing what to do about them helps no one. 3 interventions, specific, evidence-based, within your control starting today. First, morning hydration. 500 milliliters of water within 30 minutes of waking, before coffee, before breakfast, just water. Overnight, your body loses fluid through breathing, and you wake up mildly dehydrated. Your kidneys have been concentrating waste products for 7 or 8 hours. The morning hydration flush clears that concentration, reduces the mechanical stress of overnight concentration work, and starts filtration from an optimal baseline. A 2022 study in the American Journal of Kidney Diseases found that adults who consistently drank 500 milliliters of water within 30 minutes of waking showed measurably better kidney filtration rates after 12 months compared to a control group that didn't. The intervention costs nothing, takes 4 minutes. Most people skip it and go straight to coffee, which is a mild diuretic that further concentrates urine on top of overnight dehydration. Second, blood pressure below 120/80, not 140, not 130, 120. Buy a validated home blood pressure monitor. Check it in the morning before coffee, not at the doctor's office where anxiety artificially raises readings. If you're consistently above 130/80, treat it as the kidney emergency it is. Dietary sodium under 2,300 milligrams per day. 150 minutes of moderate movement per week. Reduce alcohol. If lifestyle changes don't get you below 130 in 90 days, medication is appropriate and necessary. ACE inhibitors and ARBs specifically have the additional benefit of reducing proteinuria. They protect the kidney filter directly. Every 10-point reduction in systolic blood pressure reduces kidney disease progression by 30%. That math is straightforward. Get from 140 to 120, and you've cut your progression risk by 60%. Third, stop taking ibuprofen regularly. NSAIDs, ibuprofen, naproxen, aspirin taken regularly are directly toxic to kidney blood flow. They work by blocking prostaglandins, which among other things maintain blood supply to the kidneys. 1 or 2 doses for an acute injury, manageable. 3 or more times per week for chronic back pain, knee pain, headaches. The cumulative effect on kidney function is measurable and significant. A 2020 study in the American Journal of Kidney Diseases found that regular NSAID use was associated with a 58% increased risk of acute kidney injury in adults over 40. Acetaminophen, Tylenol, does not affect kidney blood flow. For regular pain management after 40, acetaminophen is the correct choice. Reserve ibuprofen for acute situations only. 37 million people, 90% with no diagnosis. Morning fatigue that sleep doesn't fix. Waking up every night, foam in the toilet, puffy eyes, borderline blood pressure your doctor said to watch. Your kidneys have been sending these signals. Now you know what they mean. 500 milliliters of water before coffee, blood pressure below 120, acetaminophen instead of ibuprofen. 3 things, starting tomorrow morning. The blood test that catches this before creatinine misses it, cystatin C, urine albumin ratio, and 2 others.